Good morning. My name is Natalie Mera, and I'm the Executive Director of the Ontario Health Coalition. I'm here today joined by three women who are representing the community of Leamington, which really is united in its deep concern about the proposal to close their birthing unit at the Leamington Hospital due to a funding shortfall. This proposal was first announced in the fall. It was delayed in January, and the final decision may come as early as March. And at risk is the birthing unit. If that unit is to close, then women in Leamington will have to drive an hour or more in the winter to Windsor to access the nearest hospital birthing unit. It's my pleasure to introduce to you Sandra Dick. Sandra is an expectant mother who is due in April from Leamington. She's representing Save OB Leamington, which is Save the Obstetrical Services in Leamington, the local group that has come together from the whole community to save the services. And just before Sandra speaks, I just want to point out these are newborn hats that the group has brought from Leamington, 370 of them, with messages on them from community members to bring to the health minister in an appeal, really a heartfelt appeal from the whole community to save these vital services. Sandra.
Hello. I'm from Leamington and I'm pregnant. My name is Sandra Dick and I'm speaking today as the voice of pregnant and postpartum women in my community. A funding shortfall recently led to our hospital board to announce the closure of our obstetrical unit by June of this year. This will put the health of rural women and babies at risk. I am currently 32 weeks pregnant with our second child. My first pregnancy was high risk due to gestational hypertension, and I was induced early because of it. My labor was quick, particularly for a first and early induced labor, and my midwife told us at the time to expect quick births in the future. Labor signs aren't always clear, and I have no idea what to expect this time around, as my last labor didn't begin naturally. But because of my quick and high-risk birthing history, I'm terrified of giving birth on the side of the highway. My husband is an engineer, not a doctor, and while I very much want his support during labor, I don't want him to be the only one there to deliver our baby if we have to pull over on the long drive to Windsor Regional Hospital. But I want to talk about other real women from my community and real babies who are facing these same real risks with this closure. 1 month ago, our hospital saved Anna Clausen's life. She decided on a home birth after a healthy pregnancy, but she suffered a postpartum hemorrhage that resulted in a massive blood loss, and an emergency transport to hospital was required. The timely, effective care between her midwife and the obstetrical team stopped the bleeding and saved her life. This happened 1 month ago. This is a real story about a young mother who would not be here and is only here because of Leamington Hospital's close proximity to her. Having our hospital in our community saved Annie Boat's baby girl's life just 2 weeks ago. Annie was planning on having a home birth for her third child, as she has a history of fast births as well. At 7 centimeters, her waters broke, and there was thick meconium in the water. This was an emergency situation, particularly because of her previous quick deliveries. She had an emergency transport to Leamington Hospital to access the obstetrical providers needed to manage her baby girl's condition. Her baby was born less than 30 minutes after arrival, and if our hospital wasn't open, this baby would have been born on the side of the highway in the back of an ambulance, without the proper equipment and the staff to manage her daughter's situation. She's here today because of that hospital. I'm very proud to belong to a community that offers such excellent care and birthing outcomes, but I'm concerned and fearful for the potential loss of this unit and the risks that the mothers and babies like me and my child, my friends and my neighbors will face. I'm not asking for a luxury item. I have a right to ask and to expect my government to provide me and my baby with safe and accessible care for my pregnancy and birth, and that's why I'm here today.
Thank you, Sandra. Next, I'd like to introduce you to Andrea Cassidy. And Andrea is a midwife with the Midwifery Collective of Essex County. She has been catching babies for 9 years in Leamington.
I am a registered midwife and I work in Leamington. Today I'm speaking on behalf of the dedicated obstetrical team in Leamington. We know from research that birthing closer to home is safest. The recommended closure of the obstetrical unit increases the risk for babies being born en route to a hospital that's over an hour away. As a rural midwife, I am fearful of the risks the women that I care for will be facing when they have to leave their community to birth. The loss of the birthing unit brings many kinds of risks to the women and babies, such as difficulty accessing prenatal care, more injuries and death during pregnancy and labor, more inductions of labor due to distance, the loss of safety of home birth. The evidence demonstrates these types of maternal newborn risks can result in doubling the costs of these births to the healthcare system. The closure of the maternal and newborn care unit in Leamington is dangerous for mothers and babies. Leamington's OB department provides exceptional quality of care. Universal access to timely care that is close to home is at issue for this community. Rural women deserve the same access as urban women for their birthing choices. Before the announcement of the closure, a proposal was developed by the Leamington OB team that would work not only in our community, but could be reproduced across the province in small and rural hospitals. The proposal, the Leamington model, presents a plan for an integrated care throughout a collaborative model that significantly advances the delivery of the right care, the right place, and the right time to women in the rural communities.
Thank you. Next, I'd like to introduce you to Jacqui Galy. Jacqui is a concerned citizen and a business owner from Leamington.
Hi, my name is Jacqui Galy, and I'm speaking on behalf as a concerned citizen and business owner from Leamington. I have heard the voices of many concerned people, young and old, over the closure of our obstetrics unit. The fact that closing the OB is even being considered just shows one of the many ways in which rural women are being marginalized and not given the same access to care as urban women. Rural hospitals is what is most needed to best serve the needs of the people who live in smaller communities. They serve a great and vital purpose. The health and safety of people should never be compromised. Our group has come here today because we want to protect the healthcare services that our community depends on, and we see this as vital for the growth of our community from a health, safety, and economic perspective. The future of our community depends on this. The town of Leamington and its surrounding areas, of whom the obstetric unit at Leamington Memorial Hospital serves, is a unique community. Our demographics includes a distinct population. The women here often have large families and quick births. The national level is 2 to 3 births per family. In our community, births range upwards of 5 and 6 children per family. The median family income is 35% lower than the national level. This distinct population have unique barriers to accessing health care, which could include transportation issues, language issues, childcare, and social economic issues. As you may be aware, this region is currently working on an economic plan to recover from the significant negative impact it has suffered following the recent closure of the Heinz factory. The obstetrics unit closure would dissuade young families from settling in our area, further impacting our town's economic viability and sustainability. Losing the obstetrics unit will be nothing short of devastating for our community. We are here today because we want our voices to be heard by our government. What we are asking for is not a luxury or a frill. We are simply asking for women and families in our community to be able to birth safely at Leamington District Hospital. Thank you for listening to us.
Thank you. So just to close, you've heard from the 3 women representing the community of Leamington here today. Just a couple of systemic issues. We're deeply concerned. We think that the government has a plan, a policy plan of closing birthing units in small and even medium-sized hospitals across Ontario. We're seeing this trend And in recent years, Renfrew's birthing unit was closed. Brockville, just this week, is hearing rumors that their birthing unit may close if they can't find $600,000 in cuts at their local hospital. Prince Edward County Memorials, that's Picton's hospital, birthing unit closed in August of 2013. Welland and Niagara Falls birthing units were closed in the last few years. Haliburton Highland lost its last obstetrics bed, and women now have to travel 100 kilometers from there to give birth. Even in Scarborough, the plan was to consolidate, as you'll remember from 2013, the births into one site and the surgeries into the other site between Birchmount and the General. What we're asking is there a plan here to systematically close birthing units? And if so, how many births is enough? The evidence that we have seen, the evidence pointed to by the Joint Policy and Planning Commission of the Ontario Hospital Association and the Ministry of Health said that the literature, the academic literature, the studies support centralizing the high-risk births, but actually do not support centralizing all births because it's more risk for expectant mothers to have to travel further. And there's a vast body of literature on this. The Leamington group has brought here today 370 caps. That represents the 370 babies that will be born in Leamington this year if the birthing unit stays open. We think that that is more than enough to warrant protecting a birthing unit in a local community. Any questions?
I just want to go back to Sandra. If you can talk to us a bit more about that case where a woman had to drive and she almost delivered on the side of the road. So can you just give us some more detail or how did that happen and so on? And we're afraid that this could be happening more if there's no birthing center in Leamington.
Well, the risks are there we have, in our community specifically, we have a lot of women who are known for having many children, and with that, they often have quick deliveries. These particular cases, they were both quick deliveries, and they were planning home births. So they weren't planning on delivering at the hospital. Their goal was home births because of their quick history. They were already fearful they wouldn't make the hospital to begin with. And so they planned for home births because of that. In the one case, the baby was born with meconium, which is, if the baby breathes that in, it can be fatal very easily. Andrea could probably speak to that better than I could, but it's an emergency situation.
And there were other women who shared stories with you as well, who had babies who didn't make it to the hospital that were planning to go to the hospital.
My husband's
In Leamington.
Okay. My husband's coworker, his wife actually delivered in the parking lot while he ran to get a wheelchair, and by the time he came back with the wheelchair, baby was there. So it's not hard to find those stories. Before I even became involved in this campaign, I could list quite a few stories of people born halfway to Windsor in the ambulance. They've had to pull over on the side of the road to deliver with paramedics. And paramedics are wonderful, and they're great at stabilizing patients, but they're not trained specifically in delivery. If you have an emergency situation, shoulder dystocia, I think, there's 4 minutes at that point to save a baby's life. If you can't get that baby out in 4 minutes and you don't have the proper training to deal with that, that baby's at risk. And so is the mother, quite frankly.
Mm-hmm. You mentioned that, but you have many women who have multiple children, like a very numerous family, 5 and 6. Mm-hmm. So you would say that the people in Leamington have more children than the people in maybe other regions of Ontario?
And I think that the risk we're talking about is true for any woman. Any woman who has a baby and has to travel an hour away, that's a significant amount of time to be traveling while you're in labor. And birth is a normal part of our lives, but we have a safety net around it to make it safe. And that's a safety net that all women should have access to. And that's the obstetrical care that's part of our healthcare system that makes it safe. So yeah, it's every woman that's having a baby that's at risk for these.
So Natalie, you have been talking about the government have plans to close hospital in remote areas. So you have any evidence of this, and have you been communicating with the government about if this is really a plan, or is this or the hospital are closed because of the usage rate, something like this?
Services in general are being systematically stripped from smaller and rural hospitals across Ontario. We're now in year 8 of real dollar budget cuts for hospitals. So the funding level for 8 years in a row now has not kept pace with the rate of inflation. That's the global funding for hospitals. So they have no choice but to cut. That's a planned underfunding to force hospitals to shrink the scope of services that they provide, so that each hospital will specialize in fewer things, and patients will have to travel to one hospital in the region for birthing, another one for their cataracts, another one for their colonoscopies and endoscopies and so on. The thing is that birthing it's kind of one of those canary in the mine shaft things, that once you lose birthing in your local hospital, the chances that you'll lose your emergency room, your surgeries, and every other service are very high. We had stopped the closures of small and rural hospitals, won a moratorium on it about 4 or 5 years ago, but that was broken in December, beginning of December, when they closed the Penetanguishene Hospital. That's a community that's had a hospital since the 1600s, but now we can no longer supposedly afford it. And I was just tracking, I mean, as I travel around Ontario, everywhere I hear that the birthing and the mammography and all these other women's services are being stripped from the local hospitals, and it's become a big concern. And so just, in the last couple of months now, it's Brockville and Leamington are the latest communities, but as I gave you, it's the latest in a long string of communities. And we do need to get a full list from the Minister of Health. How many hospitals have lost their birthing services? It's a long, long list now, and it does look like there is a plan to close and centralize the services. But I would just caution that the notion of centralizing them is a bit of, it's a bit manipulative, because it's not like they're adding in additional resources in, say, Windsor. Like the maternity unit there is full. We just talked to a health professional that was helping women give birth outside of the maternity ward because the ward is full. So they close Leamington, all these other women have to go there, but there's no space there either. And the same is true for London and any other major town. So it's just cuts. They call it centralization, but it's just cuts, and it is systematic across the province. And we'll be meeting with officials from the ministry today and from all of the political parties to really try and raise this issue.
You did submit a proposal to the ministry. Can you give us an idea of what that proposal looked like?
So the proposal was developed in the community with consumer focus groups, and it was written by the team of healthcare providers that work there. It is a collaborative model that involves midwives, nurses, obstetricians, and family physicians. There is nothing like this in Ontario. There's a model a little bit similar in Nova Scotia, and we had a teleconference with them and spoke with them about their model. They're having amazing outcomes. There is a lot of call across the country when they look at maternity health care issues. There's not enough people providing maternity health care, so they say we need to work as a team. And especially in rural communities, the workload is tremendous. The 24/7, 365 days a year of being on call. And when we work as a team, we're able to cover that workload, and we're able to offer more because we bring on our different skills and resources. And the hardest thing about developing a team, it's why we don't see it anywhere, is because the first step is you have to have trust among your providers. And we have that. We have a team that trusts each other and are willing to share and work together. And we're already doing some of that. So one of the midwives in my group slept in the hospital last night and worked with the OB, and they covered the unit as a group. So she did all the low-risk births and low-risk triages. The OB only came in for high-risk deliveries last night, which is not the norm anywhere else. So we created this model and we presented it to the Ministry of Health. They came down and they saw it and talked to us, and they loved it. The review was like, we can see you bringing this to other communities. And then the announcement for the closure happened a few weeks later. And so everything got put on hold, and it hasn't got moved forward. And it's a solution developed by the community, by the frontline workers. And we're very proud of it. And we really think it would work in our community. And we think it's valuable to the province. We think we can role model something that could go somewhere else, because we have a team willing to do the work together.
So what has been the response from the ministry then?
So the initial response was really favorable, but since then it's been, well, you have to wait and see if your unit stays open.
Could you do that anywhere else?
And this is why this hasn't happened across the province or across the country. Far as I know, there's nothing exactly like this one. So because there's family docs, obstetricians, and midwives and nurses. So there's none with all of those groups in there. There are midwives and family docs, there's midwives and OBs, but there's not that whole group anywhere. And it's that trust, right? So you have to have trust among your group, and then you have to have your scope of practice, how we work, similar. In our college, we've talked to the College of Midwives, and they have said, we've worked really close with them, and they've said we can extend your scope so you work at the same level as the family physicians, so that works well. We've had some extra training. I took extra training to be first surgical assist. I've taken extra training to be a lactation consultant because that's a deficit in our community. So we've been putting the pieces all together. And finding that trust, it sounds simple, but it's actually a really big deal. We're all trained so differently and separate from each other. Midwifery's only 20 years old in this country, and to have a group that would say, I'll sign out my patients to you. Like, I trust that they're going to get great care, the same kind of care I would give them. And that there are women in our community who have said, we're happy to have that group care. We're happy to trust you guys to do this as a group. It's really, really unique. So it would be, in our quality of care from our community, our satisfaction rate are above the national rate. Like, we have between 90 and 100% satisfaction rate from the women in the community. And our born report card, this is the provincial way of looking at hospitals. It's above the standard for the rest of the province. Like, we provide amazing, great care. So it's not about the kind of care we provide. We actually should be a role model for other places because it's such good care. Sorry.
And when is it scheduled to close?
So originally it was March 31st, which Sandra was going to not be able to birth there. We have another woman from our community that's due after that, and she's not going to be able to birth because so July 1st is the date right now. So she's lost birth in her community. She's going to have to birth outside.
If they close it.
If they
we're
close.
hoping to stop it.
Right. Yes.
How hopeful are you, Ms. Mara?
Very. I think if one was to ask Ontarians, I am absolutely confident that the vast majority of Ontarians absolutely do not support closing local birthing services. This is an issue that cuts deep. Everybody knows why it would be terrifying to drive an hour while in labor, in the winter, trying to get to a maternity unit that might be full anyways to give birth. I mean, everyone knows what that's like. Everyone has empathy for it, and it is not supported. So the issue here is, bringing it to Toronto, bringing it to Queen's Park, raising the profile of the issue. And so it's not just people in small towns trying to fight in their own town and save the service. I hope that the minister, who is himself has a young family, will have some empathy for the plea of the people here.
Sandra, when are you due?
April 27th.
You're a little bit relieved that you'll be able to...
Oh, I'm thrilled that we've extended the deadline. I was really... the idea of driving to Windsor, just because of my history, like I've been high risk before. So if we, and I'm quick. I was quick my first birth and it was induced. So to be early, induced, and quick I'm quite paranoid. From some of the stories I heard from other women talking to them, their first baby stories were similar to mine, but they weren't even induced. And their next labor, their other labors, they never would have made it to Windsor. No chance. So I'm very seriously concerned about having to have forced inductions in the future just to avoid birthing roadside.
That will be your second?
That'll be my second. And if we have a third, which we haven't ruled out, I'm really hoping we save this unit because I don't want to drive to Windsor. I'm afraid of that, quite frankly.
It's adding to the stress. I just can't imagine.
Oh, definitely. I'd much rather labor at home. Because I haven't gone into birth naturally before, I don't know really, and even every labor is different. Even if you have gone into birth naturally, every labor is different. And so one of the women we talked to, she woke up, her water had broken, but I mean, you're waking up in the middle of the night, you're sort of groggy, you're not really believing it. By the time from start to finish, she was 45 minutes. And she just barely made it to Leamington. I think she had her baby within 10 minutes of arrival. She never would have made it by the time her parents came over to watch her other children, because it was the middle of the night. She calls her parents to come to watch her children. They get into the car. They booked it to Leamington, which is close.
10 minutes away.
And within 10 minutes, her baby was born. If she had to go to Windsor, that definitely would have been roadside. There's no doubt about it. And I mean, she was lucky. I don't think, did she have complications? No. I don't think she had complications, but if there's any complication, that's serious health concerns and risks to the mom and the baby that are not acceptable.
Is this the last push, I guess, here at Queen's Park to get the attention of the minister and the opposition parties and make them change their mind?
I think our community I don't see us ever stopping. Yeah. Like if we will,
we're not giving up without a big fight. We're going to kick and scream and.
You know, Stevenson Memorial, what's the name of that hospital? The Alliston Hospital. Stevenson Memorial. They closed their birthing unit in 2006, and they never stopped fighting, and they won its reopening in 2008, the community. And so, you know, anyway, we're hoping it doesn't come to that.
When we first got word that they were considering closing the OB, petitions went out for the Lynn, and within 10 days, we had over 7,000 signatures to present to the Lynn from people in the community who did not want to see this closure happen. And they all came out to our Roma Club to meet with the Lynn, and we had mayors and all sorts of townspeople come out and express their concerns because nobody believes this is a good decision for our community. Mm-hmm. And the hospital does not just serve the town of Leamington, it serves all the surrounding communities in Essex County, which is Amherstburg, Ruthven, Kingsville, Wheatley. We're quite a large area. So we do not want to see this Leamington Hospital closed.
There was a ton of public support for this. That meeting that Jacqui mentioned, the Lynn had an open meeting to discuss the closure. And honestly, I was going to run and do an errand before going, and I didn't because the parking lot was full. We were blown away by the response, for the community response. Personally, I've had people come up to me in the grocery store during that petition campaign to ask if I had a petition they could sign because they recognized me from speaking at that meeting. And so strangers are coming up to me asking, can I sign this, please? What can we do? So our community's been nailed with the Heinz closure. We can't take another one.
And the room was full of there was lots of families, young families, but there were senior citizens who stood up and talked, business people. Like, it's the community. It's it's everyone who's come behind this.
Yeah.
Yeah.
Well, when did they announce they were going to close it? When was that? That was in summer?
In October, I think.
It was in October. It was in October, yeah. So our when we presented to the Lynn's, they have responded at least by extending it to July 1st. That was part of that success of what we got a little bit. We got a reprieve. Well, they keep considering what they're going to do, so they're considering it. So.
And Natalie, you say they want to do the same thing in Brockville?
Well, it's just come to light, the rumors this week, at which the officials have not denied. That unless they come up with $600,000 in budget cuts, that they'll lose their maternity unit also.
So it's similar. It's a town that's similar to Leamington in terms of size.
Bigger, yeah, but big. I think it's considerably bigger. But how many people in Leamington? Do you know? 30,000.
I would
it's
say
about the same size.
Just under, maybe.
Just under 30,000.
Just under,
yeah. So. Yeah, and you know, the sizes of the towns, they vary, you know, from where they've closed birthing, from Welland, which would be over 50,000 people, to, you know, Renfrew, Brockville, Prince Edward, Picton. I mean, there's a lot now.
My understanding of obstetrical units is that in the healthcare system, they're always a little more expensive, because you can't schedule birth. Where you can schedule in surgery, you can schedule a whole bunch of surgeries and use up all your staff, and it's more cost efficient. This is the same for every unit, right? Is that birth happens when it happens, and it's why it's always in jeopardy. So.
Well, thank you very much.
Thank you.
Thank you.
Yeah.